Madam. On behalf of TSCS, we extend a hearty welcome to our Honorable Chief Guest, Shri Damodara Narasimha Garu, Minister of Health and Family Welfare, Government of Telangana, and other dignitaries. It's a moment of pride for TSCS hosting the Asian Thalassemia Conclave 2026, themed mission Thalassemia Free India by 2030. I request everybody please be seated. It will not be visible for others. Let us give some breathing space to the minister. I request all the media personnel also to kindly maintain the decorum and give some space to the audience to see the Honorable Minister on stage. Kindly cooperate. Sir has come to address us. So I request media and all the gatherings at the society to please maintain the decorum. Sir will be addressing the gathering, so please maintain. And Mrs. Vinita Srivastava also. We play the video. Please media थोड़ा पीछे जाएंगे
The
तो audience को
Thalassemia and
दिखेगा.
Sickle Cell Society, what started as a small initiative, soon transformed into a movement of hope, service, and scientific progress. TSCS began its services with just 20 patients under the able guidance of late Srimati Dr. A. N. Krishnakumari, whose compassion, foresight, and commitment laid the foundation for an organization that would one day become a national leader in thalassemia care, prevention, and cure. As the number of patients grew, TSCS expanded into a full-fledged comprehensive care center, one of its kind in the world. Today, the society runs a busy OPD and transfusion service, providing 60 to 70 blood transfusions every day, serving patients who travel not only from Telangana but from across India. TSCS extends heartfelt gratitude for the invaluable support of the Aarogyasri Health Scheme, the state and central governments. To ensure timely and safe blood supply, TSCS established its own modern advanced blood bank equipped with latest technology. Regular blood donation camps and community drives ensure that every child receives blood when they need it, without delay and without anxiety. To strengthen diagnostic accuracy, TSCS set up a fully equipped diagnostic lab with HPLC as the core technology, ensuring precise detection of hemoglobin variants and carrier status. Recognizing that prevention is the most powerful step, TSCS expanded into antenatal and family screening programs with cooperation of district collectors, DMHOs, and health authorities. TSCS is the first center to establish prenatal diagnosis (PND) services with guiding belief of awareness and prevention is the first vaccine against thalassemia. TSCS established an advanced molecular genetics laboratory equipped with Sanger sequencing, enabling comprehensive genetic diagnosis and supporting families with clarity and confidence. Beyond care and prevention, TSCS also supports pathways to cure through bone marrow transplantation, offering hope for a future free from lifelong transfusions. From 20 patients to thousands, from a single room to one of India's most respected centers for thalassemia care, where all the services are rendered absolutely free. The journey of TSCS reflects compassion, collaboration, and unwavering commitment of board members, blood donors, philanthropists, supporters, collaborators, and the entire staff. The dream continues to inspire every step. Together, we can create a thalassemia-free India.
I would now like to request our Honorable Chief Guest, Shri Damodara Narasimha Garu, Minister of Health and Medical and Family Welfare, the Government of Telangana, to address the gathering. Sir has held several key leadership positions, contributing significantly to policy formulations and effective implementation. Known for strong public interaction and people-centric approach to governance, actively involved in addressing public issues with focus on inclusive development, transparency, and social welfare. As Health Minister, emphasized on upgrading infrastructure, increasing manpower in government hospitals, and upgradation of the NIMS hospital, reducing emergency response time to facilitate early treatment in emergency cases, launched Amrut Jal scheme to supply safe drinking water to the district of Sangareddy. Shri Damodara Rajanarasimha Garu is known for his humility. Thank you, sir, for gracing our conclave. I would like to request you to address the gathering.
Good afternoon, distinguished guests gathered from all over Asia, the eminent doctors from the country. It is an experience for me. We all have dreams. We want to grow. But paying back to the society is one of the wonderful commitments an individual should have. Last time when I met Chandrakant Agrawal, we had an interaction for about 15 minutes. He was explaining to me everything. Their society functioning, their contribution, their service. Luckily today I met Satish Chandraji after almost I think about 12 years. Vinita from Government of India. About 1 week back, we had a very serious discussion what should be the policy of the government with regard to health services in Telangana. Now, Chandrasekhar is there, Satish is there. The Arogyasri concept, or the greatest contribution to the society, is the vision of late Chief Minister Y.S. Rajshekar Reddy garu. Then I was the Minister for Education. Later I was the Deputy Chief Minister of Andhra Pradesh. I believe in two verticals. One vertical is education, the other vertical is health. I served as Education Minister. Luckily, God has blessed me, giving me this medical department again. About 3-4 days back, 5 days back, we had a discussion what should be the policy of the government with regard to the health services the next 3 years. We have come up with a policy which we are going to announce it officially. The first is the NCD. The rate at which the cancer is growing. The government has to be alert, the government has to be prepared right from the village level. Second is the diabetes, HTN, hypertension, trauma care. And what should the government do to see that the common man should not come to the capital except for the super speciality treatment? So we are designing a policy wherein 90% of the treatment should be at the district level. Starting from your sub-centers, Ayushman Arogya Mandirs, to the district government general hospitals. Every district has a medical college, a minimum of 21 departments. So we want to strengthen the other departments also, particularly ophthalmology, ENT, ortho, nephrology. Not only this, we are designing in such a way that for a common man to reach a sub-center or a Ayushman Arogya Mandir, it should not be more than 2 kilometers or maximum 3 kilometers. Primary center may be about 5 kilometers or 7 kilometers. Your area hospital, which is 100 bedded, must be about 20 kilometers. Or a district hospital must be about 45 kilometers. The distance always counts. And the departments. And the most important thing now is not only your cadre, but also the equipment. So we are strengthening the equipment right from your primary health to to secondary health, to the tertiary health. Now, part of this is, around 30 years, your society is dedicated to thalassemia and sickle cell. Interestingly, I was going through this chapter. I'm not a doctor. I'm basically an engineer from Osmania. So I was going through this chapter. And then somewhere it struck me that government should have a policy on thalassemia, sickle cell, and hemophilia. What should be the policy? Like Chandrakant Patil's dream is that thalassemia-free Telangana should be there. Your society elders' dream is that there are 2-3 issues which they have brought to my notice. One is screening, testing. Every area hospital, every district hospital, we have mother-child hospitals, MCH. So it should be mandatory on the part of the government to issue instructions to all the doctors and give it in, issue a mandatory a GO, a government order, stating that every pregnant woman should be screened. Telangana has its own diagnostic centers. We do to the maximum 134 tests. But we have to specifically mention, give a direction that these tests are a mandatory for every hospital, for every patient, every pregnant. Secondly, we should strengthen our blood banks. Strengthen the blood banks. Third, as far as the financial assistance is concerned, Chandrakant was telling me that about 30% of the patients who are affected by thalassemia, sickle cell are getting the pensions, but not the rest. Government will definitely come to the rescue of those patients. And I'll personally request the Honorable Chief Minister Revanth Reddy Garu. He has a vision, both for education and health. He is committed. So I'll personally request him. Moreover, this is the profile of the design of the policy towards health in Telangana. And I like to invite the society members one day officially to my office. For a discussion in shaping the policy with regard to thalassemia, sickle cell, hemophilia. Anything else? And now the request of Chandrakant is that one of the procedures which should be included in Arogyasri. We are doing 1835 procedures. One of the procedures to be included in the Arogyasri, the request of Chandrakant and the society is that a bone marrow should be included. We will definitely encourage the society. We'll take their guidance, their rich experience, their guidance. And hopefully maybe another fortnight after this festival, we'll announce this policy and also issue mandatory instruction to all the hospitals. And hopefully, maybe the next convention, whenever it is, we should be in a position to show the policy and the documents issued by the government to your society members and the invitees. Thank you. Thank you, thank you. You know, I just want to share one more. Thank you. Yeah, please go ahead.
Thank you very much for your assurances.
My name is Giriraj Chandak. I am a former scientist at Center for Cellular and Molecular Biology. Now I have a small startup, Lightning Lives. Sir, I have a request. You have made wonderful decisions. I need to compliment you and the government. Now we are talking about elimination of the disease, right? Elimination of the disease will only happen when we are able to detect the baby before it is born. While we have to take care of the patients, of the kids who are born, absolutely important. But if we want to eliminate the disease by these targets, we have to develop prenatal sampling and diagnostic centers. Already you complimented the Thalassemia and Sickle Cell Society. They started this center. I am aware of the struggle that they all have gone through a bit. I will request you, sir, earnestly that you include this prenatal sampling also in the Arogyashri. It's not that expensive, and also request you to include the training for this sampling. Most of the gynecologists and obstetricians, they know how to use the ultrasound machine. It is a relatively very simple procedure. My colleague from Center for DNA Fingerprinting and Diagnostics is also here. We promise you
Yeah, go ahead.
We promise you that we will facilitate the training for prenatal sampling, prenatal diagnosis for any of the centers that come. My colleague from Center for DNA Fingerprinting and Diagnostics, Dr. Ashwin Dalal, he is also here. I can speak on his behalf surely that we will facilitate as much as possible, sir. Thank you very much for the time, and I really hope that this will happen soon.
I agree with you, as you rightly said. Prenatal sampling is one. We are equipped with all the necessary equipment for diagnosis. Entire Telangana, right from PSC to GGH, we are doing it. But in particular, specifically, we are not mentioning thalassemia. And whatever additional equipment you require, every hospital requires, government is ready, because the thing is, not only the cadre, the equipment is playing a very vital role in health service now. So with regard to the prenatal diagnostics or the equipment, whatever it is there, I assure you that maybe in another 2 months' time, we should be in a position to implement this program. And very shortly, we will give direction in the form of mandatory instruction to all the hospitals. Thank you all the best.
సార్ థ్యాంక్ యూ సార్. ఇంత మంచి ఆపర్చునిటీ మాకు ఇచ్చారు, ఇన్ని ఫెసిలిటీస్ మాకు ఇచ్చారు కదా. ఇంకొక చిన్న రిక్వెస్ట్, నా పిల్లలందరూ కూడా అకాడమిక్స్లో కూడా చాలా బాగా ఉన్నారు సార్. వాళ్ళకి ఒక డిజైబిలిటీ సర్టిఫికేట్ లేదు, అది కూడా
I forgot. I'm sorry. It went out of my mind. I've gone through the GO also. Government of India, they issued the GO. I remember it. Yes, I got it. Recently, 3 days back, I went through. I know it that we are supposed to issue the disability certificate. The government will act on this also. Thank you.
Thank you, sir, for that inspiring and very forward-moving statements, and the statements that we were waiting for so many years to hear from the government of Telangana. Thank you for making that announcement. I now request the dignitaries on the dais and the board members to felicitate our chief guest. Kindly make a space for yourself on the dais. After this test session, we'll be breaking for tea and then we'll come back in 10 minutes for the next session. Thank you, Sri Damodara Narasimha Garu, for gracing our occasion, taking time out from your busy schedule. And we missed you yesterday, but you made it today with such huge statements. Thank you once more. We break for tea. After tea session, we'll immediately start the next session. So please be on your chairs for the next session. Please make way for Sir to move. I request everybody to please make way for Sir to move. You can take your pictures downstairs, please.